Hello all. I'm talking on behalf of Apollo Navi Mumbai Hospital. I think in the last couple of months, we have been encountered with a serious pandemic disease, COVID-19, as we all know. This is somewhat different from all other viruses that healthcare people have been dealing with it earlier. It is different in a way because all other viruses can be dealt based on symptomatic findings, what we see for the patient. The unfortunate part with COVID-19 is that most of the cases that we are detecting for COVID are detected based on asymptomatic patients. So there may be patients who behave normally like all of us, and they may be encountering and having a silent carrier of the COVID disease. But despite all these efforts, we are really proud of the kind of work that our consultants and our frontline team at Apollo Navi Mumbai has put in. We are also happy to see the kind of initiatives which are being undertaken by the government authorities. We are working very closely with Navi Mumbai Municipal Corporation and the public health authorities to support the cause and undertake the measures which are adopted by them for the public health. What Apollo Navi Mumbai has done differently to encounter this kind of crisis, there are multiple initiatives that we have undertaken. The first, to begin with, we have created a multi-layered screening program which is available at the entrance. As and when any person or visitor come to the hospital, at the entrance itself there is a screening done, and based on the findings, the cases are being triaged in the respective areas. Also in our emergency area, there is a separate triage room which is created for dealing and handling with this kind of cases. For cases coming into the outpatient area, we have created a separate flu clinic wherein cases are detected, directed, and there are standard guidelines which are being given by Navi Mumbai Corporation to divert those cases to the dedicated COVID centers. Also, a recent initiative what we have undertaken is we have set up a COVID collection kiosk within the hospital, which will help us to get a faster turnaround time for all the inpatient COVID tests that we need to do in the hospital scenario. What we are seeing is a huge change which has happened in how healthcare has been delivered in this region. Apollo Navi Mumbai being a JCI accredited hospital, and we also have a reach with 76 hospitals in India. There are most of the international infection control protocols which are standardized, and we have adopted it early on, both for the safety of our patients and our staff and the care providers. Also, very recently Apollo has started doing regular work. We are open to undertake all elective work, elective surgeries. Our emergency numbers have started showing increase. We are doing regular work of oncology, dialysis, so on and so forth. We are taking all the universal precautions which need to be undertaken for this initiative. We are also encouraging more and more members to use a facility which is known as e-consult, which is a video conferencing consult. There is an Apollo app 24/7. We encourage all the staff members and all the patient and their relatives to start using this very actively. Also, we have launched another initiative which is known as Project I, which is Project Isolation. So in Mumbai region, we have created almost 200 beds which are available for isolation areas for people requiring home quarantine. This kind of facility can be available where we have tied up with hotels and few other business partners in that affair. What only advice what we can give you is to be a little bit more cautious, but not to be fearful. As and when you have any symptoms or any kind of symptomatic feeling of getting into those kind of things, our screening centers are totally available. Our emergency center is available 24/7. So there is no reason to panic. Apollo Navi Mumbai is here and committed to provide good quality service for you at your doorsteps. And you be rest assured that whatever precautionary measures that we need to take for the safety of our patients and the staff are already being undertaken. Thank you.